And welcome back to Mitigation Journal, the All Hazards podcast. My name is Rick Rosati. Thanks for tuning in and being with us again today as we discuss understanding flu in biologic events. Today's program is an introduction to the full-scale version that I normally give in the classroom. If you're interested in getting the full version of understanding flu in biologic events, please drop me a note at mitigationjournal@gmail.com. You can also contact me through Twitter. I'm on all the social network sites, Twitter, Facebook, and certainly you can go to mitigationjournal.org to get our blog postings and all our podcast updates, and you can reach me through there as well. No discussion on flu would be complete without a good discussion on the terms that are used surrounding biologic events. There's a few terms that are thrown around in the media quite a bit and frankly get abused quite a bit. So let's discuss these terms right off the bat. First and foremost, endemic. The term endemic simply means a disease that occurs at a high rate in any given population. This is a disease that is actually expected to be in this population, a disease that is said to be endemic when it occurs naturally most of the time in that population. Epidemic is an outbreak of new cases of a disease or a disease that's not expected or that exceeds what is expected in numbers. And finally, perhaps the most beat-up term in biologic events is the term pandemic. Now, pandemic is an epidemic that spreads over the entire planet or to such a number of people that it indicates that it's spread around the globe. Pandemic is not synonymous with avian flu, bird flu, or H5N1. Pandemic is not synonymous with swine flu, pig flu, or H1N1. Pandemic simply means that a disease has spread around the globe in sufficient numbers. Pandemic is also not synonymous with a large number of deaths either. This is one problem that the mass media had with the term pandemic back in the swine flu situation a couple of years ago, is that they expected a pandemic to equate to large numbers of dead people. That's certainly not the case. Preparing, training, and anticipating biologic events should be nothing new for us. This slide showing us way back in September of 2003 after the SARS scare that we were really concerned about biologic events and pandemics. And certainly after all the billions of dollars spent in preparedness efforts after September 11th, 2001, especially focusing on chemical and biologic weapons, you'd think we've had a better handle on pandemic preparedness. To keep on track today, I want to focus on influenza, specifically type A influenza. There are three main types of flu, and regardless of which type you talk about, they all belong to this category called orthomoxoviruses. And as I said, there are three main types. Type A, which affects multiple species. Type B influenza, which infects mostly humans. And type C, which infects humans and swine. And as I mentioned previously, we're going to focus on type A influenza. Now, type A influenza is the type that you hear associated with the H's and the N's. There are 15 different types of hemagglutinin, or H, proteins, and 9 different types of N, or neuraminidase proteins on the flu virus. They're hemagglutinin antigen and neuraminidase antigens. And if you put those two together, that gives us 135 variations of influenza A. And this becomes particularly important when we realize that the typical seasonal flu vaccine has vaccine against 2 types of type A virus. That's a heck of a job for epidemiologists to guess as to which 2 out of the 135 variations of flu out there that we could expect the most of. What we know about the flu virus is that it's one of the most infectious pathogens that we have. It also has a tendency to change from time to time, to mutate from time to time, which makes it very difficult to really corral and keep a good handle on. And that's why we see transmission so often during the cooler months, as the disease has had time to change its shape, if you will. Transmission of the flu can occur from droplets, aerosol, and direct contact, and it's important to note that the flu virus can survive off the host for up to 48 hours. And as I mentioned earlier, there can be many strains of type A flu circulating at any one time. The impact of seasonal flu is huge. An average year can produce 36 to 40,000 deaths in the United States, with most of those people affected or dead over age 65 or less than 2, or having a comorbid medical condition such as diabetes or other pathology. Epidemics tend to occur in the winter months. So what are some signs and symptoms of type A influenza or flu in general? Well, fever, cough, muscle aches and pain, and respiratory distress round out the top of the list. I've also added in here a question about travel history. When we're asking people or ascertaining their history, we should be checking for fever, cough, muscle aches, pains, and respiratory distress. We should also add to our history taking what their travel history is, where they've been, how long they've been there, how they traveled, who they've traveled with, and is anyone else from the travel party sick? What interventions do we have at our disposal to manage the flu situation? Well, first and foremost, there's vaccine. Now, the controversy surrounding vaccine in the last couple of years has been whether or not it should be a mandated vaccine for healthcare workers. I don't really want to get into that discussion today, but what I do want to point out is the bigger issue in my mind, and that is whether or not vaccines will be appropriate and available and be able to be distributed to the healthcare population and then to the general population when they're needed. Mandate or not is not really my question. I'm more concerned that the vaccines will be available, effective, and we'll be able to get our hands on them when we need them. Next is personal protective equipment, and the good news here is what we've got works. That is, masks, goggles, and gowns and gloves do go a long way to prevent the spread of flu. All we've got to do is use them and use them properly. Hand hygiene is the number one way of preventing the spread of any disease. You should make sure you're washing your hands before and after patient contact, and certainly after the use of gloves. Respiratory etiquette simply means covering your cough and sneeze, and making sure we're not spreading that droplet around any further than we have to. And then appropriate social distancing. And this is the one most employers don't want me to talk about too much because it means staying home if you're sick. If you're working in healthcare or emergency service where you're going to be out in the public and could be contacting a great deal of people in the course of your duty, you don't want to be out there spreading the disease yourself. If you're not feeling well, if you think you've got a flu, you need to be staying home. And that also means that us as parents, when they close school, that's the time to keep the kids home and not send them to the mall as well. And we can't forget decontamination of our vehicles. Every flat surface in your vehicle should be wiped down at least once a shift or after any patient that might have infectious disease. Making sure you're focusing on the cab of the vehicle as well, including the steering wheel and the microphone, to keep yourself healthy. As far as resources for tracking influenza and managing the numbers that we see out there so often and some of the misinformation, I've got 3 sources that I'd recommend for you. The Centers for Disease Control and Prevention does a very good job at putting up information on seasonal flu. A podcast through the ProMed Network called This Week in Virology does a really nice job of taking some of this technical bacterial, viral information and putting it into good terms and good conversation that just about anybody can use. And finally, Google.org, the flu trends, do a very nice job at giving you a historical perspective on what flu has been doing in your area, your state, or your nation, or even around the world, and give you an idea of when your efforts should be ramped up and predict the onslaught of flu in your area or state. Okay, that's my overview of understanding flu and biologic events. Thank you for joining us. My name is Rick Rosati. This is Mitigation Journal, the All Hazards Podcast. Please go over to mitigationjournal.org where you'll find all our blog postings and podcast updates. I'll look forward to talking to you again soon. Until then, make sure you support all your emergency service bloggers and podcasters, and stay safe, everybody.